Today we talking about the liver gallbladder disorder. The first illness we talking about liver infections. Liver infection we have a medical word hepatitis. Hepatitis itself can cause by different reasons, but generally speaking, we separate with two big groups. One group is virus infections. Another group is chemicals. Chemical caused hepatitis, like people drink alcohol for long term and a big amount, high degree, later on damage liver function, can cause hepatitis. Or maybe patient have chronic illness, need to take medication, drugs for long term, still possible damage liver functions. So that category belong to chemical kind of category. Then we have another more popular category, is virus infection category. So virus infections truly can cause the liver infections or inflammations. So virus cause the hepatitis. We have 5 different kinds. There are different kinds of virus. We give their different name, but they cause the pretty similar problems, liver infection. So that's hepatitis A, hepatitis B, hepatitis C, D, and E. So that belong to virus infection kind of hepatitis. But truly, hepatitis A, B, C is more common. D and E is not that common. In hepatitis A, B, C, most chronic one, like they can start from acute problem, then they changing to chronic problem. That's the most popular one. Hepatitis B, chronic infections. Patient may continually have symptoms and they still possible transmission to other people. So that's for today. We mainly talking about chronic active kind of hepatitis. So then we talking about what means chronic active kind of hepatitis. Like we talking about already. So hepatitis is inflammation of the liver. It continually, not healing, and more than 6 months. Then we call it chronic active kind of hepatitis. So we say the two main causes of chronic hepatitis mainly is hepatitis B and also some hepatitis C kind of patients still possible go to chronic hepatitis, but B is more popular. So that's generally we talking about chronic active kind of hepatitis. Then we're talking about Western medicine diagnosis. We know that virus infections. So truly, if we go to laboratory blood tests, we can find virus antigens, especially for that virus. So that's basically by how big amount in the blood circulation, then we can like make a checking and make a finding. And also sometimes we also can find antigens, core antigen. Core antigen means like the virus still make a copy, still living there. They still got infections. They still not stop infected. So that's pretty important laboratory test where we separate acute hepatitis and sometimes like acute hepatitis or maybe they got hepatitis infected before, but right now it's kind of healing already. So that's basically we need laboratory test. And the same thing for hepatitis C. We still can find antibodies for hepatitis C antibodies, and that's by some still library tests, by some special exam. Yeah. So that's basically. And sometimes, yes, sometimes we may take a small pieces of the liver, maybe with like a special kind of stuff, follow blood circulation, send it to the liver, maybe from the superficial of the skin to the needle there, and then take a small piece of the liver, then go to laboratory test. So then we truly find like what's the stage of the EAE. So that's basically by Western medicine. Certainly people will have symptoms first. Without symptoms, people not truly go to checking their liver most of the case. They may like a poor appetite, nausea, vomiting, and especially right upper abdominal, upper quadrant kind of abdominal painful in there, and the patient possible have fever. So lot of symptoms. Then go to laboratory test. Then we got some antigen or maybe antibodies. Clear diagnosis, laboratory test. So that's for Western medicine diagnosis. What's for the treatment? So truly we're talking about virus infection. We have some drugs or medication which are antivirus, but truly it's not that effective. So for acute virus infection, mostly depending on immunity systems, like immunity systems strong and against like a virus pathogen. For chronic one, yeah, for chronic one. So basically, we treat the symptoms and still we try to make the body strong. It's not that effective treatment like bacteria kill the antibiotics kill the bacteria. So for any kind of virus infections, it's not that effective like bacterial infections. They have special antibiotics. But truly, our body immunity system will working for that. So some of the medication will regulate immunity system. Severe case, yes, severe case. We're talking about inflammation happens in the liver. Whatever they cause, they may cause by chemicals, like the drugs, like alcohol. They may cause by virus, but whatever they cause, so they will happen inflammation, and then liver try to healing, and then damage again, then healing again. Finally, form lot of fabric tissues in the liver process. So if the liver, all the fabric tissue occupy the liver, certainly they losing the function of the liver. So that's kind of very, very severe kind of case. Maybe we need a liver transplant, but that's only in very, very severe kind of case. So that's generally we're talking about Western medicine treatment and diagnosis. Then we're moving for TCM. So TCM named illness mainly by the patient's symptoms, like people fatigue. That's pretty commonly chronic kind of hepatitis. People always talking about fatigue. We call it a 疲倦. That just means fatigue. And maybe some people painful on the right side rib cage area. That's we talking about 胁痛. 痛 is painful. 胁 is hypochondria area. Or maybe people nausea, 恶心. So people couldn't don't want to eating. We call 纳呆. So we have 老饕 illness name basically matching with patient's symptoms. Like which symptom is called the most severe problems for the patient. And our treatment we still by different pattern, TCM. So sometimes patients come in say, I have hepatitis. Can you treat hepatitis? So basically we will follow TCM pattern. We are not truly treat Western medicine diagnosis, but truly we can treat, and at least we can help. So our pattern, first pattern, liver qi stagnation. Liver qi stagnation, mainly symptoms like everybody pretty familiar, hyperchondria, distension, and painful, and chest pressure, and irritability, and the patient maybe have PMIs, maybe have irregular kind of menstruation, and maybe switch from diarrhea and constipation. So lot of symptoms. So generally say tongue is not changing too much, maybe let it be darker. Pulse usually is very pulse. So that's we say for this pattern. And the treatment principle soothing the liver for sure. Moving qi and stopping. So basically these kind of patients, they will have physical location of the liver area. they will help us. So we're talking about physical location of the liver. On the right side, upper cranial area, under the rib cage. But when people have the infection in there, inflammation in there, they may have a big liver. So if we separate the abdominal area with 4 parts, that's on the right side, upper abdominal area. So that's the physical location of the liver. It's different with field pulse. For TCM, we field pulse liver on the left side, middle position. The formula we use 柴胡疏肝散. 柴胡疏肝散 is typically the formula we use to treat liver Qi stagnation. I think you are more familiar with 逍遥散. So what's the difference with 逍遥散? And 柴胡疏肝散. 柴胡疏肝散, 柴胡 certainly herb's name. 疏肝 soothing the liver, 肝 is liver. 柴胡疏肝散 mainly working for the liver. 逍遥散 they working for the liver also, but mainly patient have symptoms. Liver attacking middle jaw cause the middle jaw disorder like diarrhea, nausea, vomiting. So for this case, to see patient symptoms, if patient have a lot of middle jaw symptoms, you still can use 逍遥散. But if patient is mainly symptoms in the liver, thus maybe you can use 柴胡疏肝散, maybe better. Acupuncture still can help. But when you do acupuncture for the patients, you need to very be careful. Hepatitis, hepatitis. Various kind of hepatitis is transmitted kind of illness. It mainly hepatitis B, mainly transmitted by the blood. So that means you pretty be careful. Don't touching patient's blood, especially the needles. Especially needles. After needle for the patient, be careful. Don't injure yourself. That kind of blood, even small amount of blood, go to circulation, still possible transmit further illness. Because we're talking about virus is very, very smaller. Even a little bit blood in there, still possible transmit for the virus. So that's we need to be careful for acupuncture. So the points we use, back through of the liver, back through of the gallbladder. It is care organ. One organ have disorder, another organ infected. And when we treat the illness, we can treat it also. So that's mainly the points we go to liver and the gallbladder. And certainly, if patient have other symptoms, you can add in more points there. So this pattern, second pattern we talking about, liver spleen disharmony. The same meaning. Liver issue attacking middle jaw. truly have more middle jaw symptoms. So patients still have right hypochondria, distension, and painful in there. We're talking about the physical location of the liver, and also maybe some pressure in the chest, in the breast tissue there, and also maybe painful in the middle of stomach area. And the patient emotions, fatigue, and maybe poor appetite, and the menstruation still irregularly, PMI still in there. Compare with last part, basically, they will have more symptoms in the middle jaw. Poor appetite, abdominal distension, pain, and no tasting in the mouth. No tasting in the mouth belong to spleen deficiency. Yeah, spleen T deficiency. That's because liver attacking stomach, spleen, and losing stool, spleen T deficiency. Tongue is a little bit swollen. Spleen T damage causes water retention, so causes swollen tongue, and could be pale, T deficiency tongue, or maybe dark tongue. So that's cause stagnations, generally coating still thin white coating, very pulse, still very pulse, or maybe thin, yeah. thin, thin, serrated, the same pulse, just translator the different way. For your board exam, TCM exam, they use serrated. Serrated is the same meaning of thin, thin. So that means defacing. So this case treatment pencil, we still choosing liver, but we need to tonify spleen, tonify the middle jaw, and tonify tibia. So this formula truly we can use cell side. We say cell side working for the liver, especially liver attacking middle jaw, spleen, stomach. Acupuncture, yeah, acupuncture. We're still working for the liver, bladder 18, back of the liver. And we're still working for the gallbladder 34, and the yuan south points of the liver 3. We're adding some middle jaw 25 points there. Some 36. Certainly you can add in more, like the back of the spleen, yeah, still working, bladder 20. Then we're talking about pattern. Spleen, stomach, means heat pattern. So this pattern mainly caused by spleen and stomach. When you go to internal medicine, you may talking about jaundice, but truly jaundice, we have young jaundice, we have yin jaundice. So that's basically belong to yin jaundice. Young jaundice usually go to the liver gallbladder. So mainly symptoms: abdominal distension, poor appetite, don't want to eat, and maybe nausea. And the patient may dizziness, fatigue, and maybe losing stool, diarrhea. So maybe pale color, maybe more yellow stool in there, and pretty bad smell. So that's some heat kind of symptom size in there. And pretty possible the arms burning sensation after bowel movement. If we look in the tongue, yeah, patient tongue still larging, yeah, larging tongue body, and maybe with some greasy tongue coating there. And the pulse, sleepy pulse. Soggy, the same translation with soft pulse. Its dumb is size. Rapid pulse is the heat size. So that's the truly dumb heat combination pattern here. Treatment principle, we need clear heat transform dumbness, and we're talking about harmonized or regulating middle gel. The formula we use, 后破半灵汤 modified. So that's mainly we have some tea, regular herbs in there. We have some herbs without phlegm and promote urination without dumbness and clear. So that's the formula we use. Acupuncture treatment. Stomacher 36. We know that's pretty 25 points. Especially spleen qi 25 points. People have dumbness condition, usually spleen qi deficiency. T and T not working. So we need 25 spleen qi. And the spleen 9, without dumbness or phlegm. And another point we say is stomach fold. Stomach 44, clear heat, especially the heat from the spleen stomach channels. And the gallbladder 34, so still regular the liver, and also clear some heat. So even we're talking about the pattern, mainly is spleen stomach disharmonized cause the dumb heat pattern, but the illness still belongs to the liver. So that's the point we use. When we're talking about the pattern, liver gallbladder dumb heat, still dumb heat, but mainly on the liver and the gallbladder. So let's see what's the difference here. Now, what's the difference with last pattern? So that means in this pattern, mainly symptoms in the liver gallbladder, like a bitter taste in the mouth. That belongs to liver gallbladder. Red eyes, headache, liver heat rising up, easily cause red eyes, headache. And the patient low degree fever or maybe alternately fever and chill. When we talking about the symptoms of fever like this, that's usually we talking about Shaoyang fever. Shaoyang means gallbladder. And still attacking middle gel, people still don't want to eat. And some special food they may couldn't eating, still possible nausea, vomiting. But just have more symptoms relationship with liver gallbladder. And even possible, people maybe have some red color, red yellow kind of urine, and possible jaundice. In this illness, that's the first time talking about jaundice. Thus, truly more go to liver gallbladder, and a little bit more severe kind of pattern here. Red tongue, yellow tongue coating, that's the heat, and maybe greasy if dampness needed, and very pulse coming from liver gallbladder, sleepy pulse coming from dampness, rapid pulse coming from heat. And the treatment principle, we still soothing the liver, so that's the same meaning, soothing the liver. And regulating gallbladder and clear heat, remove dampness. The formula we talked about before. Liver excessive heat, 龙胆泻肝汤 modified. So that's special formula, special go to liver gallbladder clear heat in there. Certainly we can add in more herbs, remove dampness, modified. Acupuncture treatment. Still, back through of the liver and the back through of the gallbladder. And liver 3 and south points of the liver, gallbladder 34. So this pattern, we can use bleeding technique. Excessive heat, we always can think about bleeding technique. We can bleed in like liver 1, gingival points of the liver, or maybe gallbladder 44. But still be careful, we're talking about the illness. If you're bleeding for this kind of patient, pretty protected of yourself with gloves and wash your hands. Don't let the needles pinch your fingers or your skin. So very, very be careful. But for the pattern, it's good for bleeding, clear some excessive heat. Then we're talking about the pattern. Damp heat transform into the fear and some fear toxin. So compare heat and fear. It's more severe heat. We say fear have two specially. One is easily rushing up, so cause the red eyes, headache, and also possible cause bleeding, disturbing blood. So originally pattern is damp heat pattern. Now it's changing to fear. Severe kind of fear, we call it toxin heat. So truly this pattern is more severe compared with the pattern we're talking about before. So rib side painful and also abdominal distension, still have bitter taste in the mouth, very, very bad smell when the people bathing, and dry, fear, damaged body fluid. And the patient maybe have emotions, irritability, easy angry, and heat disturbing shin, people insomnia, and red tuberate urination with a heat and severe kind of heat, that's fear. can damage blood vessels, cause bleeding problems. And the red tongue, yellow tongue coating, that's mainly. And the pulse pretty strong, that's we call surgical. Strong kind of pulse, rapid, and still have some dampness in there. So this pattern changing from damp heat to the fair. So still have some dampness there. So still kind of sleepy pulse there. But mainly is heat side. So this formula we treatment pencil clear heat and relieve toxins. For mainly is heat toxin. But we still using the liver. So the formula we use in Chen Hao Tang. In Chen Hao is the herb's name. Mainly working for the liver issue, damp heat. And they have a lot of clear heat herbs inside, but you still can add in more. So that's in Chen Hao Tang. And the acupuncture points, basically we still can use pretty similar points we talked about before, but we can add in gallbladder fold. Gallbladder fold is pretty good clear heat from the liver, so we can add it. So still like we talked about micro of the liver, gallbladder 34, and liver 3 still working. Then we talking about pattern. Damp heat and evading to the blood. So that's basically cause the bleeding problem. So we still have all the symptoms and the signs before, plus patient bleeding. Bleeding can be everywhere. Can be from the gums, can be vomiting bleeding, can be under skin bleeding, can be from urination, can be everywhere. So basically, it's severe heat cause the bleeding problem. So for this pattern, truly we still clear damp heat there, but truly we need cooling blood because people have bleeding problems. They have different reasons, but this pattern is the heat go to the blood and then cause bleeding. So that's truly we need cooling blood, then we stop bleeding. So we put three formulas together to treat this problem. Means that mainly is complicated situations. The first formula we still use in Chen Hao Tang. In Chen Hao Tang mainly working for the liver, damp heat condition. The second formula we use 犀角地黄散。犀角 we talked about before. That's the horse of the animals. But right now, these herbs we couldn't use is protected. We changing to 水牛角, but 水牛角, the horse have core, the special core in the always in the water. That's 水牛角, but that it still have cooling function in there. So this one mainly is clear heat problem. And another formula we use, 银花解毒汤，银花金花，金花连翘 usually we use together. Clear heat toxins. So 毒 is toxins. 解 is result. Yeah. Clear heat toxins. So that formula we still use for clear heat and toxins. So three formula together treat these problems. Means these problems truly is most severe. Yeah, severe kind of hepatitis. Acupuncture. Acupuncture we treat. So this one, certainly no marks up. We still can use breathing technique. Excessive heat, especially heat toxins, there. We always been thinking about breathing technique. Points we still can use pretty similar points here. Factor of the liver and the gallbladder, and the gallbladder 34 we still can use, and the gallbladder 43 clear heat. Fair points. Thinking about is the fair points, is the water points. Yeah, water points of the gallbladder. So truly can clear heat. So basically, clinically, we either use water points to clear heat, or maybe we use the fair points to clear heat. So that's basically, if we try to clear heat for 5 2 points, yeah, for 5 2 points, they belong to water or maybe belong to fair. They will be clear heat. And the bladder 17, bladder by heat in the blood, we can go to blood by and clear. Still cooling blood, yeah, clear heat and cooling blood. So that's for these parts. So pattern phlegm nodules. Phlegm can make nodules. So that's mainly happens in severe kind of case still. So patient have a lot of phlegm and can cause phlegm PPT. So that's usually still caused by liver issues. Kind of invisible phlegm in there. People feel something blocking in the south eye. And maybe we could even hear some sounds coming from the chest and abdominal area. And feel fullness. And certainly people still have other symptoms like a poor appetite, nausea, vomiting, losing stool, and especially some mucus in the stool. And for this case especially, we can find some nodules under the skin, or maybe like a bump under the rib cage. So what we're talking about here. So mainly enlarging the liver. So that's truly very severe kind of case. And tongue coating Yeah, tongue coating, maybe greasy coating there. Pulse, sleepy, very pulse. Or maybe softer, very pulse. So that's mainly for this part is truly have noticed it. And the treatment pistol, we need 25 spin and transform phlegm. And remove or dispersing the nodules. So for this formula, truly we need to modify. 六君子汤 is key 25 formula. Plus result some phlegm or dampness. But truly for this case, it's not stronger enough. We truly need more modified. So basically, we have some salty kind of herb can resolve nodules like 海草、昆布。We can add in there. Yeah, we can add in there. And also, we still need the herbs go to liver, like we talking about in Chen Hao Tang before. We still can add in there. So that's for this part. Yeah, that's for this part. Then we're talking about acupuncture treatment. Acupuncture treatment, we still treat Malays liver. We can go to liver 13. Find more of the spleen. Truly treat liver with treat middle gill same time. But pretty be careful for these points will needle it. So we know location of liver 13. 3/11th rib, ending part of 11th rib. And then we're talking about the liver. So liver normally under the rib cage. So that's basically we say liver like this. So these points location pretty close to liver already. And then patient have nodules there, enlarging the liver there. Then you need these points truly right above the liver. Don't needle too deeper. Yeah, be careful. Don't needle too deeper. So we still can use it, but shallow needling. Shallow needling. Usually I needle these points, whatever liver bigger or not bigger. I will direction will follow the rib cage downwards. So that's basically. And we also can go to stomach 36, still spleen T25, spleen 9 with stomach 40 together result dummy phlegm. So that's the phlegm disorder. Then we go to another part, even more severe problem, blood stasis. Blood stasis blocking the channel. So these situations or these patterns usually cause severe kind of pain. We say blood stasis usually cause the sharp pain in the fixed location. So right under the rib cage, mainly on the right side. Blood stasis belong to in-passenger. In-passenger problem is more severe in the in time, so pain worse at night. And still have a lumps in there. Still means big liver in there. And then we can find some pupil color, maybe on the lips, maybe on the tongue. That's blood stasis kind of color. Or maybe sometimes it's not whole tongue pupil. It's just kind of dark pupil kind of style on the superficial of the tongue. And also possible we can see some spandrel kind of nerve, a spandrel kind of blood vessel. So that's what means. So kind of one dot in the center. And the blood vessels, the veins, they have some like a leg around it. So if you see these kind of like skin mark or under the skin mark in there caused by enlarging blood vessels, that always means liver issue. So that's basically, and the pulse mainly is choppy pulse, blood stasis kind of pulse. And the treatment principle, moving blood, result blood stasis, and helping blood smoothly flowing in the vessels. So the formula we use, 阁下竹鱼汤 modified. This formula we still talking about before. It coming from 桃红四物汤. 桃红四物汤 is moving blood result blood stasis formula. 四物汤 plus 桃仁红花. Then we adding some qi moving herbs inside. That's 阁下竹鱼汤. 阁 is diaphragm. 下 is below the diaphragm. 竹鱼 remove blood stasis formula. So that's especially working for this condition. Acupuncture treatment, we still keep back of the liver and gallbladder, but we especially working for blood sugar or diaphragm sugar. And we still can working for liver 13, but be careful for this point we talked about. Then we go to deficiency part. Liver and kidney yin deficiency. So that's pretty commonly happens clinically. So locally symptoms pretty similar. Still red below the rib cage, some painful in there. Plus liver kidney yin deficiency symptoms like a lower back pain, knee sore, and in deficiency heat damage body fluid can cause dry mouth, dry throat, and 5 center heat, sometimes night sweating, and the people may be insomnia, and maybe have a lot of dreams because heat disturbing shen. And the patient maybe have a low degree kind of fever. And the other degree signs like a dizziness, tinnitus. We say dizziness, tinnitus is not especially common for deficiency, but in this part, it is coming from deficiency. And the right tongue without coating and thin rapid pulse. Still possible variation. So that's mainly deficiency, especially liver kidney deficiency. So our treatment principle, nourishing liver and the kidney. And we still can clear deficiency heat. Formula we use 一贯键. I believe this formula we talked about before also. So that's mainly liver in 25 formula. We still can modify the formula to see patient have what kind of symptoms. Then we modify the formula. And acupuncture, basically, back through liver, gallbladder is still in there, liver 3 is still in there, and the nourishing 25. We also can go to kidney points, kidney 6, kidney nourishing 25, and maybe liver 8, liver blood nourishing 25. Blood belongs to yin, so that's we can use. And the next part, yang deficiency. Yang deficiency. Yang deficiency mainly relationship with kidney and spleen. So patient code, patient code. Lymph code, lymph code. And losing stool. People fatigue, generally weaker. And other symptoms, maybe cause edema, because yang deficiency, yang couldn't circulation water and cause the water retention, plus other symptoms like poor appetite, generally weaker, and some undigested food in the stool. Tongue is deficiency kind tongue, 票tongue. And maybe with teeth mark on the side of the tongue, still coming from water retention. Pulse deeper and very weak. So spleen kidney yang deficiency, certainly we need warming. Warming spleen and kidney. We can use the warming herbs. We can use massage. So for spleen yang deficiency, we can use 理中丸. 中 is middle. That's spleen stomach in the middle. 理 is regulating. Regulating middle jiao herbs. And plus 四神丸. So that's basically 四神丸 warming the kidney. So that's certainly we need warming herbs inside. And we say this condition, massage is good. The points, we can go to 2-4. That's especially kidney yang, pretty good for massage there. And the 人否, generally 25 points, and our 元气 located area. And 人 6, 气海, sea of the qi, so qi 25, and the stomach 36. All the points you can use more. Certainly you can add in more, like some back 2 points. So then we go to another pattern, co-damnase. Basically, co-damnase inside and blocking there. So still have right side like under the rib cage pain and distension, and abdominal 44. And the jaundice belong to injaundice. Generally say injaundice is more cold size inside. So that patient aversion to cold limbs and also have qi deficiency symptoms. Poor appetite, losing stool, fatigue, generally weaker, and even have Shen disorder. Yeah, people losing Shen, and edema. And water retention in the abdominal area. So that's the special words we use medically. And also possible go to like a part cardio or pleural area, but mostly go to abdominal area. So water retention is more cold, dampness, water inside, and the teeth mark on the tongue, and the pulse slow and soft. So that's for this pattern. So treatment principle, we still tonify the spleen and still warming internally and relieve dampness and jaundice. So these kind of patients, mostly they will have jaundice. So we still use yin chen treat these problems, but we instead we use yin chen hao tang, we use yin chen zhu fu tang. Yin chen zhu fu tang usually used for yin jaundice. Yin chen hao tang usually we use for yang jaundice. So that's still treat patients' problems. Acupuncture, we need some qi tonified. So stomach 36 qi tonified. Marks are still good. Cold inside, marks are still good. And 人跳 middle jiao regulating. Spleen 9 still without dampness. And the liver 3 for liver 13 for liver and the middle jiao. Another point I think maybe you like to add in there, 人难 water points. Yeah, water points. Patient 出来 have more like water retention inside. We can add in 人难 to regular water. So that's part. So generally speaking, we're talking about 11 patterns for this illness, hepatitis, chronic hepatitis. But generally speaking, the pattern we're talking about from the beginning is like a simple pattern, not that severe. Then the pattern got more severe and severe and severe, more difficult to treat. So truly depending patient in which stage and which pattern, then we treat. So we're talking about the Chinese pattern. We still separate talking about here, but clinically pretty commonly combination pattern. So still you are not necessary to try to remember like the old pattern here for this illness. Basically, you still try to understanding the symptoms relationship with the pattern, the signs relationship with the pattern. Then you can make your diagnosis for sure. So we discuss separately, but clinically always mixed together. And when we treat patients, we need to see the patients, like what kind of combination pattern in there. Then we specially to treat. So that's mainly. And we talking about combination pattern. Usually relationship some damp heat inside, and then cause spin qi deficiency, and then cause maybe spin yin yang deficiency and even some cold inside. So basically, truly, we need to see like what's the clinical symptoms and the truly pattern. We treat for the illness. So clinically, a lot of time, not only hepatitis, maybe patient coming with Western medicine diagnosis for different kind of illness. But remember, for TCM, we treat by TCM diagnosis, by TCM pattern. Whatever the Western medicine diagnosis is not directly relationship or treatment principle or treatment plan. So our treatment principle and plan, we just follow TCM diagnosis pattern and plan. Yeah, so that's for hepatitis.